This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, can you guys hear us all right?
Yep, I'm clear.
All right, I'll let Catherine or Taylor, you can get started, introduce yourself.
Great. Hey everyone, my name is Taylor Johnson. I am a PGY3 at Penn PM&R Residency Program. I wanted to just briefly thank everyone for joining us. I know it's kind of a late night getting here, but we'll try to, stay on time. And sharing one of my interests for fellowship, I'm interested in spinal cord injury medicine.
Yeah, I'm Clay. I'm a fourth year, one of the chiefs, the education chief. I'm going into sports med.
Hey guys, I'm the third chief for Penn PM&R. My name is Catherine Caldwell. I'm also a PGY4, also applying to sports medicine fellowships right now. So I'm going to get started with our presentation here. We'll give you all a quick overview of everything. So our residency program has 6 residents per class. We are a categorical program, so we do have 4 spots for our intern year. And then we have 2 advanced residents who join as PGY2s. We rotate at a bunch of different rotation sites in Philadelphia, both for inpatient consults as well as some outpatient sites. So you guys can see on the top left here, it's kind of our home base. So it's Penn Medicine at Rittenhouse, also known as Penn Institute for Rehab Medicine, or PERM. So that's our home base. It's our rehab hospital. So that's where we do most of our inpatient rotations, and also has some outpatient clinics. We also rotate through the VA Medical Center for a couple of rotations. Top right, we rotate at Pennsylvania Hospital, which is actually the nation's oldest hospital, which is pretty cool. Bottom left, we rotate at the Children's Hospital of Philadelphia, which is a giant pediatrics hospital. Kind of in that bottom center there, you guys can see Penn Presbyterian, which is a level 1 trauma center. And then bottom right is the main University of Pennsylvania hospital. So it's really nice, brand new hospital that they just built within the last couple of years. And these are just a couple of our outpatient sites, although we rotate at quite a few of them. So there's that Perlman Center for Advanced Medicine, which is right by our main university hospital. Top right, which I actually think is really cool, you can see it's a football stadium, but kind of embedded on that left side, if you look at the picture, is the Waitman Hall clinics. So we do sports medicine clinics that are right there by the football field. And then that bottom center is kind of a brand new, like modern outpatient site at 3737 Market, where we do some outpatient like musculoskeletal and EMG clinics. So this is just a little map of Philly to show you all where our rotation sites are at. Most of them are quite close together within walking distance. So you guys can see the kind of orangish yellow stars there are where we rotate at. So over on the left-hand side of the screen is in what's called University City. So that has like Penn Presbyterian, the main university hospital, has the Children's Hospital and the VA as well. You guys can see kind of in the bottom center of the screen where it says Good Shepherd Rehabilitation Center. That is our rehab hospital, which again is our kind of home base there. And then over on the right side is Pennsylvania Hospital that we rotate through mostly as interns, and then again during PGY2 year for consults. So you can see that most of the rotation sites are quite close together over in the University City area. So rotation-wise, if you all do the categorical program, you'll start as interns. So you can kind of see the list of rotations we do. Most of them are a month, with a couple of them being a little bit longer. You get a really nice foundation in medicine and surgery, kind of a little bit of everything. You do get to do 2 months of elective time. That can be honestly anything you want, and then a month of PM&R. For our PGY2 rotations, this is where you have the majority of your inpatient experience. So you do a rotation outpatient at CHOP, which is our children's hospital, and then you do 2 months of each of the 3 different inpatient rehab services over at PERM. So we have the inpatient medically complex service, stroke and amputee, and spinal cord, and then your other inpatient experience is at the VA. So as a PGY3, you do 2 inpatient rotations. So one is traumatic brain injury. Again, that's at kind of our home base there at PERM. And your other one is 2 months on CHOP inpatient rehab, which is pediatric rehab. The rest of the year is spent on consults and some miscellaneous outpatient clinics. PGY4 year, you do 1 month total of inpatient. The rest of it is all outpatient, with 2 of those months being electives. So again, electives are kind of anything and everything you want. You can see some of the past selections there, but really everyone is open to letting you do whatever you'd like to do. So residents in the past have kind of pieced together their different interests and kind of put together their own schedule. So we're quite flexible when it comes to electives. And then for our call schedule, we do in-house call at PERM and home call at the VA. So most of our call is front-loaded in the PGY2 year, with much less in the PGY3 year, and honestly hardly any in the PGY4 year. So again, it's in-house at PERM. So the 2s cover a lot of the nights and holidays. And then as you kind of progress through your training, you do a lot less call. And then the home call at the VA is only done as a PGY2 or 3. Typically people get maybe 1 call while they're at home, but almost hardly anybody has to go in.
So I'll talk about resident education. This is a picture of our sports med fellow learning 10X procedure. So our didactics, these are every Wednesday, weekly didactics from 9 a.m. to 1 p.m. This is protected time. So we have a nurse practitioner that works with us on inpatient who signs in for our patients, takes all the calls and pages. We use a 3-tiered approach to our didactics. So we have a research curriculum, we have a board review curriculum, and then high yield clinical topics, which are covered by attendings. So we'll see a sample schedule on the next slide, but this repeats annually. So while you're in the program, you'll get the curriculum 3 times. Lunch is provided, and then we have free tea and Keurig coffee, importantly, 24/7. So that's nice. This picture, this is us learning how to do blood flow restriction therapy with our PT, and this is us learning like eSTEM with the hands-on didactics portions. On the right, you see a sample of our August schedule. So we go through board review chapters, which is led by a senior resident. We have on Wednesday the 10th, a research curriculum. So we talk about like responsible conduct of research and how to critically evaluate literature. Grand rounds on Tuesday, and then, ankle, foot, running injuries, being a team doc, and SCI journal club throughout the rest of the year or month. In addition to that, we have monthly ultrasound course that is led by attendings and fellows. We do a cadaver dissection anatomy course, which is nice. We do, as part of that, we do a hands-on teaching a physical exam. We do clinical scenarios with a guest attending, and then we have pro sections in our own cadaver to dissect and practice ultrasound guided procedures on. And that happens yearly. We do EMGs, optional EMG nights where people can get some hands-on exposure. And then monthly, while you're inpatient, the PT and OT therapist will teach you therapy modalities while you're on service. In addition to that, we go to 4 courses throughout the year. So we go to the GATE, an orthotics course by Temple, We'll do the EMG course at Jeff. And then we host an ultrasound course, which our residents also attend. And then we'll do a prosthetics course, which we also put on. So a lot of courses throughout the year, which doesn't go into vacation time or education time. So we get, as far as research and education, we get a yearly education stipend, which is about $700, which can pay for books, computers, phones, or going to conferences. The program pays for a board review course during your 4th year. So as a group, you pick which one you want to go to, and they'll send you there. We get funding to present research at national conferences. So you can see us at AMSSM, SSAAP. We get education days as PGY 3s and 4s, which is in addition to vacation, which you can use to go to conferences. And then we also get our annual enrollment fee covered for AAP and AAPM&R. The research curriculum, like I said, it's built into our didactics. We have a departmental statistician who helps us do put together our research and get our manuscripts out. And then there's resident funding to actually conduct research too. So each resident can apply for up to $1,000 to put on their research project and recruit applicants or participants. As far as sports coverage, we have access to all the Penn sports. So on the left, you can see a sideline at football games, courtside at basketball games, or sideline at lacrosse. But if there's a sport going on, all you have to do is ask and you can go show up and participate. We do physical exams for athletes. So in the center, you see us at Waitman Hall on the inside. This is one of the big days where we work through a bunch of athletes, getting them ready for their seasons. We do a lot of large mass participation events. So you can see us on the bottom center at marathon, bottom right at a marathon, and then Penn relays, of course, we cover, which is a great, brings in like Olympic talent from around the world. So you get to see a lot of cool athletes and help out with that. And then we're at the Broad Street Run in the top right. I'll turn it over.
All right, so this is Taylor again. I'm going to chime in here about another great part of our program, which is the Healthcare Leadership and Quality track. This is for residents in their 2nd year of residency, and it's not limited to just PM&R. So this is something that is the system-wide at University of Penn Health System. It's a really great way for those of you interested in QI, which is quality improvement, or patient safety initiatives. It's a great way for you to not only learn some advanced training during your residency program in these important endeavors, but also a great way to interact with other residents from different fields. So I am a part of this track. I'm in my 1st year, and Clay is also in this track as his 2nd year in the program. And just some quick tidbits about it. By doing this residency track program, you can become a leader within the department. The QI project actually meets the research requirement that our program has. So that's great. You kind of kill 2 birds with 1 stone. And then the excellent part is that it doesn't add any extra years to your residency. This fits in really nicely with our program. So it doesn't take up any extra time. And I'm happy to share more information about this program if anyone's interested. So living in Philly, these squares that on the map kind of highlight where most of the residents live. And if you live within one of these 2 areas, you're pretty much set up very well to easily make it to all the sites where we rotate. And we're happy to talk more about that as well. So here's a slide just about, some of the great things about Philadelphia. I'm not sure how familiar everyone on this call is with the city of Philadelphia, but I'm sure that you've at least heard about a Philly cheesesteak at least once in your life. So that's in the top left. But we also wanted to highlight that, Philly is full of excellent cuisine from all over the world. There's some photos of some of our residents getting some food in the bottom left. Then in the center there is City Hall, which is one of the oldest buildings in the city, and it's just very picturesque, and everyone's always taking pictures around this building. They always have tons of events going on and festivals for every holiday you can think of. Just below that is the Art Museum, which aside from being an excellent art museum, also is the site of many festivals and concerts within the city as well throughout the year. When we cover the Philly Love Run, we actually are located just below the art museum steps, and it's just an awesome part of the city that we all enjoy being in. And then more extracurricular things that the residents are involved in. In the top right, you can see that Clay and his intramural soccer team, who won a championship this year, I think, Clay, you were saying?
Yeah.
And then the next picture down is a bunch of the residents who got together to hang out with one of our residents that just recently graduated on one of Philly's many rooftops. And then below that is Wissahickon Park, which is, a surprisingly large metro park within Philly and only 20 minutes from where most of us live. And it's really great break from all the bustle of the big city. Also, many of you may be familiar with our excellent sports teams. I am from the area, so I could go on all day about how great our sports teams are, except for the Flyers. I don't think they're doing too hot recently. But yeah, we go to as many games as we can. And if we can't go in person, we usually try to catch the games at a bar. And then just more photos of wellness. I think the first one on the far left of your screen is after one of our anatomy sessions. We all hung out, even though it was like probably 9 o'clock at night. We just wanted to get together and we had a great time eating some great food. Then in the fall, we went apple picking as a group. And then the top right is a photo of all of our wonderful senior residents at our graduation from this past spring. So yeah, we can't emphasize enough how much we enjoy each other's company at this program. We really do have a great time, and the camaraderie and the family atmosphere at Penn is really what drew me in the first place. You can see a pretty intense game of spike ball in the center, bottom picture in the center there, and then just various other events that we do throughout the year. So when we're, we have a lot of fun, but we get the work done, and we do very, very well when it comes to fellowship match. There's really, I can't think of any resident in the past, recent past that hasn't matched to the fellowship and within their top 3 choices. So here's just a general overview of where our residents go and what we choose to specialize in. And, I think this slide is a great representation that Penn PM&R is a great wide spectrum of PM&R education. We have residents going into just about every specialty, and it's not included on this slide, but this year we have our senior class, 3 of them are going into sports medicine. We have 1 going into spinal cord injury, 1 going into brain injury medicine, and then 1 that is going to go into general rehab and already has several job offers.
And you have about 3 minutes.
Oh, okay, speed it up. Fellowships available at Penn. We have sports and spine. We have brain injury, peds rehab, which actually takes 2 residents per year. Sports medicine, we have a dedicated PM&R track, and that residency is kind of integrated with family medicine, I believe, as well. Clay and Catherine can tell you more about that. And then we also have cancer rehabilitation. So we'd like to open it up for questions. I'm sorry, we're a little bit short on time, but that's us. We have a question from the chat about procedure numbers. I don't know if Clay or Catherine, you guys want to tackle this one.
Yeah, procedure numbers haven't been an issue. I think I met all of my requirements during my 3rd year. So 4th year has just been excess. You do an elective in ultrasound, or in sports med, you get all your ultrasound and spinal procedures easily. And then EMGs were well over 200.
Another one from the chat. What is something new in your program that you were all excited about?
I'm pretty excited about our softball team, which we brought back after it had fizzled out during COVID. We won our first playoff game, and we only watched an attending tear a hamstring. So that was like pretty mild considering what could have happened.
I just piggyback off of I'm going to tackle this question too. I'm excited about all of the new faculty that we brought in. We have some very, very energetic and excellent faculty members that are joining Penn, PM&R, a couple sports and spine physicians from excellent fellowship programs. We have dedicated research faculty joining us as well. And we just got a brand new spinal cord injury attending who actually did his residency here and his fellowship at Pittsburgh. So I'm excited about the growth of our program. I think we have some very young, energetic leaders joining us to add to the excellent attendings that we already have.
And if you can just put your email in the chat, prospective applicants can send you some more questions. Thank you very much. And otherwise, we're going to pass to the University of Pittsburgh.
All right. Good night, guys.